I get this question a lot. If I already have a child with autism, should I get tested for folate receptor antibodies before trying to have another baby? That's a thoughtful and important question, and one that many parents are asking as they plan ahead and look for ways to reduce risk. Hi, I'm Dr. David Danish, a double board certified psychiatrist in child, adolescent, and adult psychiatry, and I specialize in autism and neurodevelopmental care in general. Let's walk through this together. Folate receptor autoantibodies, often called FRAAs for short, are immune proteins that can block how folate, or vitamin B9, is transported into the brain and developing nervous system. Folate is crucial during pregnancy for this reason, not just for preventing neural tube defects, but for supporting early brain growth, normal brain development in utero, gene regulation, and what we call methylation processes that influence development in all organ systems. Studies have shown that women who already have a child with autism are more likely to carry these antibodies. And that's true even when standard blood tests show normal folate levels. In other words, you might have plenty of folate in your system, but if those antibodies are present, the folate may not be getting where it needs to go to the developing baby. Testing for those antibodies using something called a FRAT test can offer valuable insight. But one quick note there too, and this is important, that FRAT test isn't perfect. While it's one of the best tools we currently have, we don't yet know its full sensitivity. That means a negative result doesn't always rule out the presence of these antibodies. In some cases, a false negative is possible. So, this is where clinical judgment, your personal family history, and your unique situation all come into play. If antibodies are detected on the test, one potential next step is folinic acid, a special form of folate that can bypass the blocked receptors and still support fetal development. And if you're thinking about growing your family, it's always wise to bring this up with your OBGYN or maternal-fetal medicine specialist. They're going to be important to help coordinate testing results, but also give the okay for any supplementation, ensure everything lines up with your prenatal care plan. If you are exploring leucovorin as a potential treatment for autism or for this concern over cerebral folate deficiency that you may carry, we've created a careful and clinically responsible way to access it, even outside of traditional in-person visits. To see if you or your loved one may qualify for a prescription of leucovorin, visit the leucovorin page at Philadelphia Integrative Psychiatry and complete our secure, physician-reviewed intake form. This is part of a complete asynchronous approach to getting leucovorin out there to those who need it most and in a very quick manner. This does so while upholding the highest standards of safety and individualized medical review. The link is in the description. If you're not ready to start treatment but want to learn more about FRAT antibody testing, which can reveal if the immune system is potentially blocking folate, you'll also find details and test ordering options on the same page. And for those who want to dive deeper, including optimal dosing by weight, current research, potential risks, and benefits, check out my MindVolt resource at drdaviddanish.com. That link is also in the description. I am committed to bridging access and responsibility, making evidence-based care available to more families without cutting corners.